Hi, everyone. Today, I want to talk to you about thyroid hair loss. Now, I know this is a very triggering topic as a lot of women, even men, associate their femininity or masculinity, their beauty with the length and thickness of their hair. I have seen beautiful people with short hair, long hair, thin hair, no hair. But I understand for women especially why thyroid hair loss can be really devastating. And I myself have suffered both types of hair loss, one being general thinning thyroid hair loss, and then there's autoimmune hair loss, which is known as alopecia areata. General hair loss and thinning is known as alopecia. And then the autoimmune hair loss is alopecia areata. Now, alopecia areata is when you have very specific circular patches of baldness all over your scalp. Maybe it's one patch, maybe it's two patches. I suffered, like I said, through alopecia areata, but also through really bad thyroid hair loss. And I'm going to show you a picture of what my hair looked like years ago. And I couldn't put my hair up in a half ponytail or in a ponytail because you could absolutely see the whiteness of my scalp against the sort of stark black hair that I had. And it was, it was really tough. But ultimately, thyroid hair loss is really, and general thinning, especially in women, alopecia, is really a result of what is happening on the inside of your body. And of course, if you're putting a lot of product in your hair or using shampoos that are kind of unclean and filled with chemicals, or you're, constantly straightening your hair and teasing your hair or pulling it with a hair dryer, maybe even washing it with hard water or not moisturizing your scalp, that can all have an effect on the thickness of your hair. Now, what's interesting is that sometimes certain types of thyroid medication, actually one of the most prescribed thyroid medications, can actually worsen hair loss. And I know that's not very intuitive, but I've had a number of clients tell me that once they started synthetic thyroid hormone, a certain type, that their hair loss actually became much worse. So we're going to talk about now. Again, I'm not a doctor. I can't advise you on which thyroid medications to take, but I can tell you you should absolutely research all the different types of thyroid medication out there. A lot of times it's an investigative process and you have to find out which thyroid hormone medication is working for you. So let's get into some of the nutritional deficiencies that can affect your hair and what labs can tell you whether you are potentially facing a nutritional deficiency, which might be the explanation for your hair loss. So our systems are basically in survival mode when the thyroid is not functioning properly. And everything slows down from metabolism to digestion to nutrient absorption. Many with hypothyroidism suffer from low stomach acid, which hinders the body's ability to fully break down food into its usable components. This can lead to nutrient malabsorption and is the biggest contributing factor to hair loss in women with thyroid issues. Digestive enzymes aid in this process. So, I've said before, I really like pure encapsulation, digestive enzymes ultra with betaine and HCl, again, which is stomach acid. So essential hair nutrients are vitamin E, biotin, and vitamin A. Cod liver oil supplements can be hugely beneficial too. However, as with all vitamins, correct dosing and the quality and bioavailability of the vitamin with a supplement is key. Too high doses of selenium and vitamin A can actually contribute to hair loss. So the essential nutrient vitamin E is a powerful antioxidant that helps protect hair from damage caused by free radicals. Some studies have even suggested that vitamin E may help to reduce hair loss and thinning, making it a valuable addition to any hair care routine. You can find vitamin E in a variety of hair products, or you can take it as a supplement to support your hair health from the inside out. Not all vitamin E is the same. I will link to a vitamin E that I think is wonderful and contains the best form of vitamin E for your hair. Um, One by Pure Encapsulations has a great formulation for both thyroid and hair health. If lab tests reveal that you are deficient in vitamin D, which many people with Hashimoto's and hypothyroidism are, then you will most likely need to add more vitamin D to your supplement routine than what is contained in the one formulation by Pure Encapsulations. Also, adding magnesium to your routine is also a good idea. You can find one by Pure Encapsulations on Amazon. I will link it below in the comments section. Okay, what will also be linked are my specific vitamins for hair loss on my Amazon storefront. Now, obviously, I do earn a few pennies for whatever you purchase through the link. You do not have to purchase through the link. Now let's talk about lab tests that you can do. Ferritin is a protein that stores iron in the body and releases iron when the body needs it. Now, testing for iron sometimes is not really a great indicator, but testing for ferritin can be more conclusive. You can have normal levels of iron and low levels of ferritin, indicating that your body is making enough healthy red blood cells, but that the body is not using it properly. And low levels of ferritin can lead to hair loss and weakened hair shafts. Iron plays a crucial role in delivering oxygen to cells throughout the body, including hair follicles. When there isn't enough iron in the blood, the hair follicles can become starved of oxygen and can lead to hair loss and thinning. It is essential to get your iron levels checked if you are experiencing hair loss or thinning. So test both iron and ferritin. Low iron levels can be caused by a variety of factors, such as poor diet, lack of certain proteins, heavy menstrual cycles, and certain medical conditions. A doctor can perform blood tests to measure your ferritin and iron levels and determine if you need to take supplements or make changes to your diet to improve your iron intake. Addressing food sensitivities and intolerances. True story, my hair started regrowing only once I gave up gluten. I tried all the supplements that were touted as miracle workers for regrowing hair, but nothing worked. This was because I had a gluten sensitivity. Eating gluten caused a lot of inflammation and resulted in nutrient malabsorption for me despite taking supplements. The only real solution was to completely eliminate it. The truth is, most people with Hashimoto's thyroiditis or any autoimmune disease find relief when they give up gluten. This is because they have leaky gut, and elimination of inflammatory foods like gluten and like dairy is the first step in trying to heal a leaky gut or stop the inflammation of the intestinal lining. Leaky gut leads to nutrient malabsorption. Now, diet is a significant factor in hair health, as a diet that is lacking in key nutrients can lead to dry and dull hair. But also, if you have intestinal permeability, which a lot of us do, even if you're eating a great diet, you might not be absorbing all the nutrients you need to in order to maintain healthy hair. So, and supplements only work when we are consuming natural whole foods in our diet, because in order for supplements to actually work, they need something called cofactors and enzymes, and those are only found in real food. So if you're eating McDonald's and eating potato chips out of a bag, and you think that taking supplements are going to help you with nutrient deficiencies, think again. Again, you can believe me or not believe me, but high sugar consumption leads to hair loss. Okay, that's because sugar irritates your immune system, it irritates your gut lining, and it also raises cortisol in the body, which then leads to inflammation. Now, are topical treatments effective for thyroid hair loss? I personally believe that nutrient deficiencies should be prioritized as a first line of defense when trying to stop thyroid hair fall naturally. This does not mean that there is no place for natural topical treatments in your overall approach. It is important to remember that topical treatments usually do not address the root cause of hair loss. Okay? So be aware of whatever you put in your body whenever it comes to topical treatments, okay? Certain treatments may contain chemicals that have harmful effects on the body, but also specifically to your thyroid gland. Since the thyroid gland plays a crucial role in regulating metabolism and other functions, it is important to be mindful of any treatments that can affect thyroid health. Therefore, be cautious and choose treatments that are free of harmful chemicals. Topical application of natural oils. Let's get into it. An important aspect of hair care is ensuring that your scalp and hair are well nourished and moisturized. There is an effective solution that you can incorporate into your hair routine. Extra virgin coconut oil and also olive oil is a great substitute. By applying nourishing oils once a week, you can significantly improve the health and appearance of your scalp and hair. Coconut oil acts as a powerful moisturizing agent and can help to prevent dryness and irritation to your scalp. Additionally, nutrients found in coconut oil are easily absorbed by hair strands, infusing them with essential vitamins and minerals that promote healthy growth and vitality. Using extra virgin coconut oil is a simple and highly effective way to give your hair the nourishment it needs. All you have to do is slather about 2 or 3 tablespoons of coconut oil into your hair and scalp, massage for a few minutes from root to tip, wrap in a towel for at least 30 minutes to 1 hour, and then wash out your hair as usual. You probably will need 2 cycles of shampoo. I tend to leave my hair with the oil overnight and then wash it out in the morning. Just make sure to have a large towel covering your pillow to avoid oily bedding. Longer term steps to avoid thyroid hair loss or to stop it. One is to optimize thyroid hormone levels. Getting your thyroid on track can seem like a daunting task, but many times it takes a combination of dietary changes, high quality supplements, stress management, sleep management, and medication if necessary. Okay, so it is important to test well beyond TSH to really determine whether your thyroid is functioning properly. And again, you can go back to the lesson on thyroid labs, but essentially you absolutely want to look at free T3 and free T4, and again, iron and ferritin levels. My TSH kept coming back normal for years, even after I had my Hashimoto's diagnosis. So other things that you want to look at are, again, it's in the lab section with thyroid antibody levels, TPO-AB and TG-AB. So a thyroid ultrasound can help reveal the full picture of what's happening. So let's talk about stress in the role of thyroid hair loss. Equally important is to keep stress in check, okay? High levels of cortisol can contribute to hair loss by signaling the immune system to stay in flight or fight mode. This state, this high stress state, essentially diverts the body's attention away from what it considers secondary functions like hair health, nail health, even fertility. So, and digestion. Consistently being in flight or fight mode makes the body habitually concerned with escaping or fighting the stressor, and survival becomes the focus. Things like deep breathing, even 5 minutes a day, can signal your body to relax and let it know that it's safe. It enters the parasympathetic nervous system, which is what we want. Now let's talk about gut health for healthy hair. Lastly, taking care of your gut health is essential. A healthy gut can improve nutrient absorption, which in turn leads to healthy hair growth. If you're ready to take back your health from thyroid issues and reestablish the thyroid gut connection, you can sign up for my 10-week online course called Thyroid Gut. I go through cyclical hair loss every year. In the summer, I always, for some reason, my hair is just a lot thinner. And I don't know if it's because I'm eating less, red meat, or maybe I'm just kind of, because it's so hot, I have maybe more salads and maybe less protein, or I'm having a little more sugar from things like watermelon and different fruits. But my hair always thins out pretty significantly during the summer. And then all of a sudden, as autumn comes and it starts to get colder and I'm eating sort of more vegetable and meat stews, my hair just gets thick again. So it's just hair. But I am here to tell you how you can improve your hair health. And it really, again, starts with what's going on inside of your body. And there are things externally that you can do to help your hair health.